Hi, and welcome to my YouTube channel. My name is Sarah Peternell. I'm the owner of Family Nutrition Services in Denver, Colorado. Today's video is about the T3 medication, often known as Cytomel. Okay, this is one of the medications that may be available to you as a part of your Hashimoto's or hypothyroid medication regimen. I get a lot of questions about what is Cytomel, why would you be interested in taking it, and how does it work differently. So keep in mind, I'm not a doctor. I do not prescribe this medication, but I am a Hashimoto's patient myself, and I'm a Hashimoto's patient advocate, and I'm board certified in holistic nutrition, and I'm a Hashimoto's expert when it comes to the diet and lifestyle measures that are really important for living your best life with Hashimoto's. So what this means is that the rainbow bridge, right? The gap between the medication and the standard treatment, the kind of the standard protocols of treatment, which are medication, and those lifestyle measures that you can take into your own hands to eat better, feel better, live your life better. This is where I come in. And so knowing about medications and knowing about different options so that you can go into your doctor's office and be fully informed and fully prepared to ask the right questions is really important. Now, if you have questions and you're going into your doctor's office, you might want to check out my Hashimoto's checklist. It's a really great handout, and it's free. So just visit my website. The link is in the pinned comments down below. But this can be a great tool or resource for you to have the next time you go into your doctor. Okay, so back to T3. So a lot of times patients or my clients will actually learn about the benefits of T3 when they have a doctor who recommends this type of medication because they're not getting better on just T4 or Synthroid or Levothyroxine. Have you watched my video about why Levothyroxine sucks? Check that one out too. So a lot of times if a person's not getting better, then maybe their doctor says, gosh, I don't know that this medication is right for you, and you may do better with also adding in another medication, which is T3. So that's what I really want to focus on today. So knowing if you do need to use this is definitely, a very personal decision that you would make with your physician. A lot of times, this is going to be based on your thyroid blood levels, right? So your doctor is going to look at labs and decide, okay, yeah, based on the dose that you're taking and the way that your labs are looking, meaning you may still have a high TSH, you may still have low T4, high T4 and low T3, low free T3. This might mean your body is not converting the form of T4 that's in the medication into the active free T3 or the free and available, most usable hormone in your body. So what might be happening is that you may have a genetic condition where your body is lacking some of the enzymes that are needed to convert T4 more efficiently into T3, and so that's where supplementing with this medication can help. You may also have some other issues going on, maybe metabolically, where you are not utilizing the medication properly at the cellular level. So we sometimes call this like cellular hypothyroidism, basically meaning you have a lot of T4 circulating through the bloodstream, but it's not getting into the receptor sites, the thyroid receptor sites in each and every cell. So your labs may even look fine, but you're still feeling really crummy. So a couple of things to keep in mind. Your doctor may talk to you about a T3 medication if she measures your reverse T3 and it's high, meaning that basically instead of producing the free T3 or the active form, it's all going into reverse T3. Also, if you have any of these metabolic issues like prediabetes, if you have like metabolic resistance or syndrome X or insulin resistance. Some of these other conditions may also contribute to why your body's not using your T4 properly. And sometimes the test that the doctor will do for you is to see if you are actually leptin resistant. And so leptin is one of the hunger hormones, and so your doctor may want to do a fasting leptin to see if it is also high, because this may indicate some of those metabolic conditions that are preventing you from really using your medication in the best way. Also, if you have an elevated fasting insulin, if you know you have diabetes, prediabetes, or other blood sugar issues, as I said, these can all be reasons why your doctor may be thinking about a T3. This one's interesting. I read research recently that T3 may be helpful in patients who have a history of fibromyalgia, chronic fatigue syndrome, or those who have chronic muscular pain. And this is often, especially the fibromyalgia and the chronic pain, is often one of those kind of like thyroid receptor site resistance issues, meaning that like your labs look normal, but you're just still feeling really crummy, and nobody can seem to figure out why when you're taking the proper dose of, say, Synthroid. So if you are one of those people that's like really prone to kind of the chronic aches and pains, or maybe even cyclical aches and pains, your doctor may be interested in speaking with you about the addition of T3. And sometimes you may have tried some of the other natural desiccated thyroid medications, which you can also find videos about those as well. And maybe those didn't work, right? So maybe the natural desiccated from the bovine or from the porcine, origins, meaning that they come from the desiccated thyroid of an animal, and if your body's not doing well with that either, then your doctor may consider doing a combination of Synthroid and Cytomel together. So my clients ask me a lot, I'm 20 plus years into my Hashimoto's journey, and my antibodies are well within the normal range again. I attribute so much of that to the diet and lifestyle measures that I've taken over the years, but I do still take medication because I had so much thyroid damage done over the years before I really had some of this stuff under control. So I currently take a combination of Tirosint, which is levothyroxine, in like basically like a little gel capsules. There's no added anything, which is great because of having celiac disease. It means I'm going to absorb it and utilize it really well. And I also take a small dose of T3 to help support some of those conversion T4 to T3 issues. I never really like to think about it as a diagnosis for myself, but in the past I did have doctors say, well, you kind of have fibromyalgia or chronic fatigue, because before I started really getting a handle on Hashimoto's and doing things naturally, I was really tired and I did have a lot of aches and pains. So reading that research is interesting. I wonder, how many more people maybe who are new on their diagnosis journey, or maybe how many people like me earlier on just had things that kind of wouldn't resolve with medication and treatment, might do better with the addition of a T3. So, okay, I'm going to go through just a couple more things. Again, because I don't diagnose, treat, or cure, that's not part of my scope of practice. But here, as your Hashimoto's patient advocate, I'm really just kind of giving you some things that you should probably talk to your doctor about and make sure that you have all of your options in front of you. Okay, so let's see. What would be some of the benefits of using this type of medication? Well, I think that for a lot of people who really have been struggling with weight loss with their hypothyroidism, T3 can be one of the things that kind of really helps to support a healthy metabolism. You may remember from some of my other videos that the key thing about your thyroid is that it helps with thermoregulation, right? Your body temperature and the way that you utilize the nutrients from your food as fuel for energy. And so taking some of the T3 medications may help speed that up a little bit and support weight loss. It's not meant as a weight loss drug, but for some people who have Hashimoto's and hypothyroidism, they find when they add in T3 that they start to feel a little bit better with their weight. So that could be one of the nice side effects. And again, I said the higher basal metabolic rate. So people who are trying to conceive, women who come to my practice and they're doing like temperature taking and they're tracking, cervical changes and mucus changes, and they're going through a lot of the steps to understand, okay, with Hashimoto's, what do I need to be paying attention to so that I can know if my body's ready to conceive? One of them is a temperature. And so elevating your basal body temperature through the addition of T3 can be very, very helpful in complementing the natural food, supplement, lifestyle, potentially maybe other things like acupuncture, etc., that you're doing to boost your chances of getting pregnant. So that's really good as well. I talked kind of just generally like it may help to reduce symptoms, which is really good. But it may also help to improve other hormonal imbalances that are going on. So I have a lot of other videos about hormone imbalances and the ways in which all of this stuff is connected in the body. Our reproductive hormones, our adrenal hormones, our thyroid hormones, men, women, it doesn't matter. Sometimes the addition of T3 really helps to kind of get things back into normal levels, not just for your thyroid, but also for your other hormones. So that may be one reason, is if you're like, God, my period is irregular, or man, my testosterone is low. These would be reasons to bring it up to your doctor as well. Okay. Also, we talked about, blood sugar dysregulation. I do have a lot of information on my website and here about blood sugar and the relationship with Hashimoto's. So check that out. But if you know you're pre-diabetic, or you know you're leptin resistant, or you know you're insulin resistant, talking to your doctor about T3 might be really helpful for you as well. So, okay, so I'm going to leave it there. These are just some of the top line things I think that are really important for you to know, to take the information from today's video, to download my free Hashimoto's checklist and take it to your doctor, and to just find out, based on my symptoms, not everybody with Hashimoto's responds the same way to medication. You want to feel well, you want to feel your best. You're already hopefully doing a lot of the lifestyle and dietary things that I've highlighted here in my videos and on my website. And if you're looking for more in depth on like elimination diet, going gluten-free, managing stress, etc., you want to join my Nourished and Renewed with Hashimoto's 30-day program. So find that in the pinned comments below. I would love to see you on the other side. Thank you so much for joining me for these videos, and I'll be back soon with more. Take care. Bye.